for Dawson.
Thank you very much, Mr Deputy Speaker. And I rise to speak about the issue of doctor shortages in the Whitsundays. And it seems strange that such a beautiful area and one of the greatest tourism destinations in the world cannot seem to attract enough local GPs, but that is the situation, and I've spoken about the impact of this issue on several occasions in this place. And today I want to focus on some good news and suggest a better path for tomorrow. The Whitsundays has now been declared a district of workforce shortage, which opens the door for foreign-trained doctors in the Whitsundays to apply for an exemption under Section 19AB(3) of the Health Insurance Act 1973. And as a result, we hope to see one of the doctors who's left the region because of issues there, Dr Solgi, return to the Whitsundays with his wife, Dr Sheva, who is also obviously a doctor, who had to leave because she was not allowed to work in the same practice with her husband because of the restrictions that will now be removed because of this DWS declaration. But as I said, they've not been able to do that because of the restrictions in the Act, restrictions which can only have been overcome with this DWS. So the declaration is welcome for the overworked doctors currently operating the Whitsundays and for residents who need and deserve proper health care. But I do question the process by which these declarations are made, and I note the Department of Health on their website outlines information used in making these determinations, including the latest Medicare billing statistics, which account for all active Medicare billing and therefore give an accurate indication of the geographic distribution of doctors across Australia. Well, I'm afraid, Mr Deputy Speaker, that doesn't give an accurate indication at all. The data is converted into full-time equivalent doctors to work out a ratio which caters for many doctors working part-time, but doesn't account for few doctors working far too many hours. Now, Dr El-Baki from 121 Medical Centre at Whitsundays advised me yesterday that his practice had 30,786 patients on the books, cared for by himself and 2 part-time GPs. And that figure only includes patients who had presented in the past 2 years, which suggests the formula isn't working in the real world. The department's second source of information is ABS census data, which is supposed to give an indication of geographic distribution of the Australian population. Well, that census, a snapshot in time, is a poor indication of how many people are in need of a doctor in an area where tourism is the biggest and almost only industry. International tourists get sick, but they aren't covered by Medicare. And then Whitsundays, with only a small resident population, they see 600,000 interstate visitors a year. If 10% of those visitors need to see a doctor on their holidays, it's an extra 60,000 patients. Whitsundays sees a high turnover of doctors at the Proserpine Hospital, and with their Medicare provider numbers attached to the region, it creates an impression there's a lot more GPs than there actually is. So this flawed data does not account for the reality, and I think the system needs to be reviewed or the minister given power to intervene.
Order. Call the honourable member for